بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is talking as aorta as one of the structures in the upper abdomen and continuation of my basic course of upper abdomen anatomy. Aorta travels from the abdomen anterior to the vertebral body. This is the aorta here, and this is the vertebral body, and it is a retroperitoneal structures, and enter the diaphragm at the level of T12. And the aorta has intimate relationship to the inferior vena cava. The first branch in the abdomen is celiac trunk, and the celiac trunk, it is divided into three branches: the splenic artery, common hepatic artery, and left gastric artery. As we see, the common hepatic artery, this is branch of celiac trunk, and it supplies the liver and the stomach and the duodenum, and gives rise to gastroduodenal artery, and the gastroduodenal artery is here lateral to the pancreatic head. This is a landmark, and also that it gives gastroduodenal branch which supply the duodenum with blood, and this branch is also wrapped around the greater curvature of the stomach, supplying it with the blood, and anastomosis with the left gastro-mental artery, which is a branch of splenic artery. Another branch is of common hepatic artery is the proper hepatic artery, which supplies a blood supply to the liver, and which gives rise to the right gastric artery, and this vessel supplies the lesser curvature of the stomach. The splenic artery, this is the splenic artery, and this is the celiac trunk. The splenic artery is one of the three branches of celiac trunk, and this is the largest branch of the celiac trunk due to high amount of blood flow to the spleen, and it travels posterior to the fundus of the stomach and gives rise to a branch called left gastro or mental artery before entering the hilum of the spleen. And the splenic artery divides into 5 or more branches into the splenorenal ligament, in that area. Before entering the hilum of the spleen, the left gastro-omental artery supplies the blood supplies of greater curvature, and this artery can be a site of aneurysm formation. And here, this is the second branch after the celiac trunk. This is the superior mesenteric artery. The superior mesenteric artery is the second branch of the abdominal aorta after the celiac trunk, and the vessels travels through the pancreas in between the head and the uncinate process of the pancreas, as we discussed. And it is located left to the superior mesenteric vein. This is the superior mesenteric artery, and here this is the splenic vein, as we said, and this is the splenic vein again, and this is the superior mesenteric artery, and this is the superior mesenteric artery, and this is the splenic vein. Renal artery is branches of the abdominal aorta. This is the left one, and this is the right one, and it is about at the level of L1 and L2. And before the renal artery, it is the inferior mesenteric artery. So this is the abdominal aorta, and this is the right crest of the diaphragm, and this is the left crest of the diaphragm, and this is the vertebral body. And this is the common proper hepatic artery, and this is the common hepatic artery, and this is the splenic artery, and this is the celiac trunk. And this is the portal vein, and this is the splenic vein, and this is the confluence to formation of the portal vein, and this is the gastroduodenal artery, which is branches of the common hepatic artery. And this is the gastroduodenal artery, and this is the splenic vein again, and this is the superior mesenteric artery, as we discussed, and this is the renal vein, left renal vein draining to the IVC, and this is the left renal artery, and this is the right renal artery, and it is posterior to the IVC. Let's talk some notes about the blood supply to the liver. As we said in the part 1, the liver is supplied by dual blood supply, the portal vein and the hepatic artery. The portal vein supplies the liver in about 75%, and the hepatic artery, it is supplied about 25%. And the hepatic artery, it is coming from the celiac trunk, and the celiac trunk give rise to common hepatic artery and the proper hepatic artery, and the proper hepatic artery, it is divided into the this is the common hepatic artery and the proper hepatic artery, it is divided to the right and the left hepatic artery. And we have also 3 hepatic veins, the left hepatic vein, right hepatic vein, and middle hepatic vein for venous drainage to the liver through to the IVC. Sometimes the liver is supplied by accessory artery coming from the superior mesenteric artery. As we see here, this is an accessory or replaced branch. If there is no right renal artery, no right hepatic artery here from the common hepatic, and this is the replaced one. If there is hepatic artery here on the right side, and this is an accessory one. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.